I'm Heather Slowinski, Sales and Marketing Associate at United States Drug Testing Laboratories, and I'm here with Dianne Montgomery, a neonatal nurse practitioner from McCady Hospital in Ogden, Utah. Dianne has over 40 years of nursing experience, most of which were spent in neonatology and pediatrics. Dianne first came to USDTL back in 2001 with the idea of testing umbilical cords for drug exposure in newborns. And since then, numerous hospitals have transitioned to CordStat. Thank you for joining me today.
You're welcome.
So what sparked your interest in umbilical cord testing?
Well, I think most hospitals had the same issues that we had with meconium testing. We were thankful for that test because it certainly has helped babies, but some of the problems that we noticed were some babies do pass meconium before they're born, and so we are not able to collect any after their birth, and other babies would go home before we could collect any meconium. Little premature babies sometimes don't pass meconium for a week or so, and the other thing is our nurses just didn't like to collect the meconium. And so one day, as we were meeting with a representative of the U.S. Drug Lab, trying to figure out, is there something we could do different, or can we collect this any faster or have a faster turnaround time? I started to think of the different tissues that we can look at to check for drug use in the mom. Anyway, the babies have hair, but not a lot of hair, and we had tried sending some hair to the drug lab, but usually there was just not enough, and moms don't really like us to shave their baby's head. I knew they didn't have long enough nails to collect, to test, and so I started thinking, what other tissue would be possible to collect from a newborn that we could use. And then I started thinking about cords and how the cord is with the baby from the very beginning, and maybe that lining that's there, or the Wharton's jelly, would collect anything, any illicit drugs in any of that tissue, and that maybe we could look at that tissue and find that. So that's what got it all going.
Great. And then can you describe the process your hospital went through transitioning to umbilical cord testing from meconium?
Well, this whole idea was back in 2001, and so it took quite a few years of testing. And when we finally realized that, yes, indeed, we can get the same measurements as we can with meconium in testing for these drugs, we had already had quite a bit of experience with our nurses and our labor and delivery room nurses collecting the cords for those studies. So that did help us. But once the nurses realized that they no longer had to collect meconium, I think that was a huge thing for them. It was much easier to send the cord. So then it became a process of just figuring out, what exactly do we need, how much cord do we need, how do we package it, those kind of questions. And then our labor and delivery room nurses found that it was quite easy to take a certain amount of cord. They could quickly strip it of the blood, able to rinse it really fast, put it into a container, hand it with the baby to the nurse, and that nurse would label it immediately, and we'd put it in the refrigerator, and then within an hour be able to send it. Or if we had some suspicions that there might be some drug abuse in the mom, we maybe would wait and keep that cord for up to a week, deciding whether or not we needed to send it.
Okay. And what specific advantages have you found of using umbilical cords instead of meconium for testing?
I think there's a lot of advantages. I know our nurses do now love it because they don't have to collect any meconium, and there's just very little to do to get that sent off. But we have babies that are born to moms that maybe have been admitted illicit drug use or prescription abuse during their pregnancy, and we're able to ship that cord out within hours after the baby's born, and we're able to get the results back a lot faster and be able to treat the baby, and that's been a big advantage. Other than that, I think that's probably it.
Do you find that you are able to test more newborns than with the meconium?
Definitely, because as I said before, some babies have already passed the meconium, or they maybe have gone home before we could even collect the meconium. Another advantage is many of our little tiny premature babies will not pass meconium, sometimes for a week.
Mm-hmm.
And yet we suspect that there might be some withdrawal going on in that baby. And again, this is such an easy way, to just take that piece of cord and send it and get back the results so we can begin treatment for the baby. And it doesn't delay treatment necessarily if we don't have results back, but it is nice to know exactly what is in that cord and what we are treating.
Right. So what would you like to see in the future of newborn drug testing?
One of the things that we're working on right now is testing for alcohol in the cord. And we know that meconium is about 60% accurate for alcohol. And we know how important it is to know if the fetus has been exposed to alcohol. And it would be nice if we had a test that could tell us that, so that when those babies go home, that those pediatricians or physicians that are treating the baby are able to get those babies who have been exposed into some early intervention and developmental programs and make sure that they can get the best follow-up that they can.
Okay, well, we look forward to seeing that, and thank you for joining me today.
You're welcome.
And thank you all for watching USDTL's live web series, and remember to keep checking USDTL.com for future episodes.